Today we'll be discussing the most commonly sexually transmitted infection known as HPV, also known as human papillomavirus. Today we'll be going over some of the research done over it. And toward Bjorn Ramkvist study has shown that there is an increase of orphangeal squamous cell carcinoma, also known as OSCC. And the increase of this has been due to different types of HPV infections. The increase of OCC has not only occurred in the United States, but in other areas such as the Netherlands, Sweden, and the United Kingdom. In another study done by De Souza in 2000 through 2006, the researchers reported that there is an increased risk for an oral HPV infection due to open mouth kissing and this increases with lifetime oral sex partners. In another study done by Dr. Megan Trad in 2008, a study was done at Texas State University. She hoped to decrease the risk of HPV by speaking to the university students. Her studies shown that among these students, many did not fully understand the virus and that it can be transmitted through skin-to-skin contact, and that men were usually misinformed of the risk with HPV. Many of them believed that the only cancer that could arise from it was cervical cancer, but it has been shown that penile, anal, neck, and head cancer can be developed through men with HPV. Today we'll be at Indiana University and we'll be interviewing some of the students here. Do you mind if I ask you a few questions?
No, that's fine.
About sexually transmitted diseases?
That'll be interesting.
Do you know the name of the most common sexually transmitted infection?
No.
It's known as HPV, and according to the CDC, nearly all sexually active men and women will get this at some point in their lives. There are 100 strands, which is why over 14 million cases arise each year.
In U.S.?
Yes, it's just that's how you get it.
How do we get it? Like, how is it transmitted?
Most people who have the infection either do not show signs of the symptoms, but in some cases health issues can arise, such as genital warts. But since most of the time people are unaware of the infection, it can lead to more serious issues such as cancer. HPV strain 16 and 18 cause 70% of cervical cancers with women.
So, like, is it only transmitted through sexual activity, or there are many other ways that it can be transmitted through?
Well, it can actually be transmitted through vaginal, anal, or oral sex during sexual activity, as well as close skin-to-skin contact during sexual activity. There are also studies shown that you can get it by just sharing food or sharing drinks.
That's scary, right?
Yeah. In men, the only way to actually know if you have it is if you get any of those symptoms, since there is not actually any HPV tests available for it.
Like, but they're available for women, right?
Yes, for most of the time, women will get either a pap smear or yearly checkups by their gynecologist, and then they'll find through cervical checkups if they have the HPV strain.
Is there any vaccine or something that can be given, or temporary treatment?
Yes, since there is no actual test for men, the only way to, a really for sure way to protect themselves is to get a vaccine, and there are vaccines available for men and women, usually around the age of 11 to 26 years of age. But if you do find that you have HPV, there are treatments options available for the health problems that arise. So due to things such as genital warts, there are treatments for that. And if you do catch the cervical cancer early enough, you can be treated for that as well. But for the virus itself, there is no treatment available.
Okay. That's a lot of information. Thank you on that.
No problem. Just remember to have safe sex.
Thanks. Have a
Thank
good day.
you.